Hi, so October is celebrated as Breast Cancer Awareness Month, and I'm here to talk to you about hereditary forms of breast and ovarian cancers. We know breast cancer in women is very common. About 1 in 8 women are identified to have breast cancer at some point in their lifetime. Of these, we know 5 to 10% of women have an inherited genetic change that can increase the risk of developing breast or ovarian cancer. So we know if 100 people were diagnosed with breast cancer, about 5 to 10% of those people will have genetic changes related to their breast cancer. The two most common genes you will hear about in breast and ovarian cancer syndromes are BRCA1 and BRCA2. These genes essentially stand for breast cancer 1 and breast cancer 2. Your doctors may often recommend genetic testing, or you may have read about genetic testing for these two genes in the realm of breast cancers and ovarian cancers. There are certain red flags that we identify when we are concerned about these genetic changes running in a family. You often see that breast cancers happen at older age, so over the ages of 60s, or that there is really no family history for somebody with a breast cancer diagnosis. In contrast to that, when there is an inherited genetic change in the family, breast cancers tend to occur at a very early age, usually less than 45 years of age. We also see that there is a cluster of cancers in the family. Sometimes you may see a mom, a sister, a grandmother, maternal aunts, paternal aunts developing breast cancer. We also see other rare forms of cancers like ovarian cancers. We also see males developing breast cancers, which is uncommon in the general population. And along with that, we also see that males can have prostate cancer and pancreatic cancer risk. Males and females both may also have a melanoma, which is a type of skin cancer. So these are the clusters of cancers that we see in the families. So when we think about red flags, we often identify that family members may be diagnosed at a young age. There may be clusters of multiple family members in the same generation, or multiple generations being affected with cancer, and a combination of cancers in the family, including breast, ovarian, pancreatic, and prostate. Sometimes we also see the same member of the family diagnosed with two types of cancers. So a left breast cancer first, followed by right breast cancer, or a breast cancer and then followed by ovarian cancer. So these are all signs and symptoms that would make us more concerned about an inherited form of cancer in the family, in which case your doctors may recommend genetic testing for genes such as BRCA1 and BRCA2. Now, these are not the only two genes associated with inherited forms of breast and ovarian cancers. We also know that there are other uncommon genes associated with these inherited forms of breast cancer. And sometimes when you meet with a genetic counselor, they may recommend genetic testing beyond the BRCA1 and BRCA2 genes.